A report from Policy Exchange suggests NHS hospitals in England have failed to recover a healthcare bill of more than £250 million from patients from overseas for the last 3 years. Now, the report had a foreword from Sir Sajid Javid, who has been a former health secretary. And the foreword that he's written for this report says that the NHS is not a charity or an international aid organisation. Here's Director of Research at Policy Exchange, Iain Mansfield.
When you look across the hospitals which we investigated, what seems to be the case is that there is a wide-scale deprioritisation of recovering this money from overseas patients. The collection is very poor. 39% is the total amount of money collected, and that's £250 million lost over 3 years, money that could have been spent on nurses, equipment, doctors, and the like.
Shouldn't the way this is managed change in that case and demand perhaps upfront payment?
That's certainly one possibility. The other thing that we argue is that there should be much stronger action in holding NHS Trust chief executives accountable for this. So we argue that any chief executive that doesn't achieve at least 50% of the money collected should be losing their bonuses. And the final thing that we recommend is that there should be much more join-up between the NHS and the Home Office. And so if someone applies again for a visa to the UK and they've got unpaid NHS charges, then their visa would be automatically declined unless they pay those charges in full with interest.
Is it a question that they are chasing it, but it's just not coming back the other way? They are being, what I'm trying to say is that they are being diligent about it. It's just that the money isn't coming back in.
No, so I would say there's been this, as I say, this wide-scale deprioritization. If you look at some hospital trusts, the worst performing only collected 4% of the money that was collected. We also have some very interesting things, that there may be an attitudinal problems in places. For example, the West Yorkshire Health and Care Partnership declared itself a partnership of sanctuary with a local City of Sanctuary scheme, and these sorts of partnerships with these external organisations really call into question whether the NHS trusts in question are prioritising the collection of money from overseas patients.
The NHS has said they've recovered more money so far this year compared to previous years. You might respond by being startled that it's worse in previous years than current.
I mean, I think we're starting from a very, very low base here. Again, when you have multiple large NHS trusts which are collecting less than 10% of the money which is owed to them, we're not talking about, tiny village hospitals here. We're talking about major NHS trusts with significant resources, and it's really been completely unacceptable. I think I was shocked by quite how poor it was. We expected to identify that there was a significant amount being unpaid, but the fact that more than half of it was quite stunning.
What about the impact on patients from the UK? Are there any tangible impacts that you can spot?
I think the big thing is that this is money which could be reinvested into the NHS. We look at how much it is. It's £250 million, which is quite a lot. This is thousands of nurses, which could be being hired for that money. And ultimately, you have these people who are due to pay. We're not talking about, long-term residents in the UK who will have paid their NHS surcharge. We're talking about people who are coming over on short-term visas, ostensibly for tourism or for business, and they're going in and they're having this extensive NHS treatment costing thousands of pounds, and then they're just absconding without paying their bills. And of course, that is taking up beds, it's taking up places which could be being used to support UK patients.
Could there not be an argument to say, well, if they're going to pay, they should be sent to the private sector to deal with these issues?
You could say that. There's obviously also some cases, emergency treatment, of course, where people need treatment quickly, and you can't exactly quibble on where that goes. And I think the NHS is right. It is right. The NHS should be there for people like that, but of course they should then have to pay afterwards.
What about now? I'm veering into territory here. A health insurance system for overseas visitors, then?
An interesting question. You're essentially saying that before you come over, you should be required to demonstrate that you have health insurance.
Well, I do if I go to the United States, for example.
It's a very interesting question. That it's not something we looked at, to be honest, but it's certainly something which the government could explore.
The NHS is committed to delivering the best possible value for taxpayers' money, and in line with regulations, providers of NHS-funded services must identify chargeable overseas visitors and take all reasonable steps to recover costs. For non-urgent care, payment must be secured in advance, and urgent or immediately necessary treatment will be provided without delay, in line with the NHS's commitment to patient care. The NHS has recovered more money so far this year compared to previous years, but we are determined to go further and working on a variety of measures to achieve this. That's word from the NHS in response to that report from Policy Exchange.